talk about the dialysis crisis, because over 90% of Ghanaian kidney failure patients who desperately need dialysis are being denied access to this life-saving treatment. This is according to a yet-to-be-published study titled 50 Years of Hemodialysis in Ghana, Current Status, Utilization and Cost of Dialysis Services. This study, authored by a nephrologist at KNUST, Elliot Coranting Tano, and his dedicated team, has unveiled statistics that expose the harsh reality of the situation. I've been joined in the studio by my colleague Raymond Aqua, who will break things down for your understanding. Then we can understand the crisis at hand. Raymond, let's start with the statistics. And first, let's look at the number of dialysis in the whole country.
So the report suggests that there has been an increase of dialysis centers from 15 in 2016 to 51 currently. However, 11 centers actually shut down or are yet to actually open. In the Greater Accra region, which has the highest number of them, there's a high density of 8 centers per 1,000 kilometers squared, compared to 0.29 per 1,000 kilometers in the Ashanti. The high concentration in the Greater Accra region actually makes it reflect the population density that we have in the region. So of the 51 total centers, the private sector has expanded much faster than the public sector. So there are more dialysis centers in the public sector, as in public hospitals and related areas, than in the private than the public. Now, there are 37 private centers across the country and only 14 public centers. So the private centers are 72% of the dialysis centers that we have in the country. Now, private sector growth has been over 235% since 2015, when they were first introduced, the private operators in dialysis. In comparison, the public sector has grown by around 80% since 1972, when the first dialysis center was actually opened in this country. Now, there's more that you should know. Regionally, Greater Accra dominates with 33 out of the 51, which means that 65% of all the places you can do dialysis is in the Greater Accra region. After that, Ashanti has 9 centers. Now, of the 40 currently operating centers where dialysis can happen, 27 which are private and 13 which are also public. There's also something that we should know keenly about them. There are 9 non-operational centers that have shut down, and 2 new private centers which is beginning to open, which will soon be opening in the Greater Accra region. If you put it together, it says a picture that having Greater Accra region alone, having 65 across the country, there are 7 regions in this country that do not have at all, which is problematic. Problematic because they have to move to other places or more expensive places to actually get dialysis done.
So now you've talked about the geographical distribution. Let's look at the capacity of the centers in these regions you talk about.
So we have so far, in all of the 40 currently operating, 299 dialysis machines. Yes. So if you break it down, this is 9.7 machines per every million population. So if you break down our population, for every 1 million people, there are only 9.7, about 10 machines.
For the one to save the 1 million people.
Yes, that's what it actually means. There's more to that, though. I mean, of course, this is far below what Ghana is needed to serve that population. There's an estimation that there are 15,400 patients with kidney failure that require dialysis.
Over 15,000 patients.
That should be actually going through dialysis. Now, if you put it properly here, we are now talking about a median number of per machine, 6
to 1 machine. 6 people to a machine,
to a machine
at any given time.
This may make it look like, oh, that's good because it's a limited number, but it's not dispersed properly. The northern region, for example, has 1 center, which has just 5 machines. So 2.3 or about 3 machines to the population per million in there. So every 1 million people in the northern region, there are just 3 machines for them to use.
Or 2.5, if
yes,
you want
if you want to,
that.
I mean, take it to that actual end. Yeah. Now, the Bono East region has 1 center and only 3 machines for the 1.2 million people in that region. So only 3 machines for the entire population of 1.2 million.
That's
assuming even 50 people.
Adequate.
Yes, that's where the problem is. Even in where we say is the best served region, we are talking about the Greater Accra region.
Okay.
The 227 machines work out to only 50 machines per million. And that's equally low.
Okay.
Now, let me compare it to global picture so that we know where we really
are.
Ghana's capacity is extremely low, and I'm making the point that the US has over 2,000 dialysis machines per million population.
Interesting.
For every million population, the US, they have 2,000
over
dialysis machines.
2,000
yes.
machines compared to about 9 or 10.
Yes, for
which is
Ghana.
Even not evenly distributed.
Yes, and which are 65% of them in the Greater
Accra region.
Now, if you move it along that, most average high income or low income countries have 1,000 per million.
Oh, wow.
1,000 machines per million.
Wow.
With such limited...
That means 10 people to 1 machine,
yes.
which is acceptable in I mean, compared to our situation, we would manage that.
So with such limited capacity, most of the centers, they are unable to manage the demands. And let's not get it wrong. People prefer public to the private sectors for dialysis because public is cheaper than the private ones, regardless of what we complain about consistently with such a median. Now, one of the other things that should be of interest was that the limited dialysis capacity has been a major problem for utilization and the quality of care for kidney failure patients.
Okay.
So people necessarily will choose alternatives like going to other places to seek healthcare, or not seeking healthcare at all because of the cost involved. But if it is not within their scope, because mostly if it's not within their scope, they are less likely to get any education about it.
That's where I bring in the bit about accessibility. We know that we don't have a number of them. Most of them are centered in the Greater Accra, and it's not evenly distributed.
Yeah.
But the accessibility is another conversation we can have. Is it accessible? If you listen to people who say they go to Kolebu has now reduced the renal unit to emergency cases because of some of the problems they're facing right now. How accessible are these machines to people who really need them?
So the report puts the figure that even though they expect more than 15,000 Ghanaians should be seeking for dialysis care
Services.
currently, there are 1,195 dialysis patients.
Okay.
And 299 machines total.
Okay.
So the ratio indicates that the dialysis centers are operating at near or even over capacity, given the recommended ratios. There's another compounding factor. Let's look at it keenly.
Okay.
There is data that suggests that on average, you pay about 4,000 per month. In fact, there were in the studio of Joy FM today.
Okay.
There were others, the patients who were indicating that they pay more than just that.
Okay.
Their indication is that they are paying within the range of 6,000 to 7,000. 6,512 to 7,000.
For treatment?
For treatment, because it is not just the dialysis itself that's the end of the conversation.
Okay.
There are other medication, and mostly you may be on dialysis because you have acute or what they call a chronic kidney problem.
Okay.
But that means that there might be another underlying factor which is already created a problem, like diabetes, like hypertension. So if you put all of these factors together, we are looking at having to pay more than 6,512 CD as the cost for assessing this.
Okay.
Over the year, if you do that cost variation, we are talking about some 78,000. How many Ghanaians? There's a study that suggests that 70% of Ghanaians are paid less than 3,000 in the public sector.
True.
So if the gentleman is paid less than 3,000, how did they afford dialysis alone, which is double their salary?
6,000. Okay.
So, and over the year, about 78,000. How do they rake in all of this amount of money? Where would they raise the money from to be able to afford it? That is why some people then choose to, instead of having 2 or 3, because the explanation is that you need that consistently done to clear your system.
Yeah.
they will do it once or not do it at all. They think that if they resort to other forms of medication and other things, it would replace the kidney's function in their system or rebuild their kidney properly. Of course, we are being told clearly that if the kidney breaks down, you need an external kidney, which is the dialysis machine, to do the job of the kidney. But because they cannot afford to go through this and pay this amount of money, that is why all of these calls are being made. But you look at it properly. If the average salary is way out of the reach of the dialysis patient, some will necessarily die because they cannot access it.
So I'm hearing
beyond it being very far from them, even if I'm able to travel from a very remote area to the city to go and get a dialysis machine to use, I need to pay through my nose.
And so that means that even if it was at my doorstep, I still won't be able to afford it.
And that's it's not why on the National Health Insurance Scheme.
Exactly. And I'm hearing that some people have had to reduce their intake of water and reduce their intake of food just so they would not overwork the kidney, so they wouldn't have to go to the dialysis center.
So output,
which could affect
the quality of health and the quality of life they are supposed to have.
Exactly. So that could even bring about other health effects. So in all of this, I think government has a big role to play. What's government support in all of this?
So the conversations were on different levels. One, at first, the conversations about what to tax and what not to tax. I've heard analysis that if I had hypertension right now, I am paying more than 2 times the amount of money I used to pay for drugs. That grouping, hypertension, which then developed into a problem with the kidney later on because of the impact of that he didn't know. So he's treating hypertension with drug differences. They moved on to now come and treat kidney problems and go on dialysis. If the cost of those drugs for hypertension has gone up astronomically because of the times we find ourselves, and of course the exchange rate and all of those other factors involved, then also kidney cost is also on the ascendancy, like we've been told and been discussing over the period. Certainly somebody will be asking, is it possible that we make some of these drugs and consumables connected to kidney care free for every machine that's supposed to be delivering that? Or if government feels that people would abuse that system of giving them tax exemption and also giving them the no duty payment, why don't we then give the subsidy to the patient? So a special card for kidney patients or those going through dialysis so that they don't have to pay, or it is heavily subsidized. You get my point? That is how we can intervene from the top. Healthcare systems work this way. You put in preventive measures. You advise people. You encourage them. Stop the things that will get you there. But we've been told that there's a lot more than just having to abuse alcohol or do the other things that will compromise your system. There is even the possibility that you being involved in an accident may have an impact on your kidney, which has absolutely nothing to do with the lifestyle that you led. So that is also important that we put in not only the preventive measures, and speak to people more about education. We also need the other measures, which will be reducing the disease burden and reducing the cost of seeking treatment so that we can encourage people to seek treatment. Perhaps we should start from the cost of checking whether your kidneys are okay. If we made it almost free or even at a very lower cost, that people do not have to wait till they have swollen feet or any of the other extraordinary signs of danger before they actually get in. The people who are diabetic, the people who are actually hypertensive are asked to consistently go for some checkup on their kidney too, because it might be impacted by the existing condition that you are having. Perhaps we reduce the burden of those having to get to the dialysis level before we now have to put them on that expensive process of treating them. So if we tackle it from along the value chain, every element would not only look at reducing the cost for it, but asking people to seek early care, asking people to check regularly, so we can prevent a degeneration of the status of the what they call the kidney. Perhaps it will help. Of course, we have discussed the tax element. We have discussed the alternatives of even giving people the opportunity to have, if it's cuts, if it's specific treatment plans, then they can be helped out that way.
I am also happy to hear that the National Health Insurance Scheme is saying that it would include dialysis on the NHIA, the scheme, so that people can assess as to how beneficial that will be.
You are being more optimistic. What I've heard them say is that they are considering that.
They are considering.
Of course, they have to also consider the impact on the entire scheme and the amount of money they so, for example,
get
if they
annually.
have 2 million and they are making other things free, would it mean that they will need extra sources of money?
Don't forget
Some
that.
have suggested that we should, for example, redirect all the monies from the COVID levy that we have been taking, even though COVID is no longer a major factor today, into kidney care specifically, or support the NHIA, because the NHIA appears underfunded consistently.
It is.
It has difficulties with delivering on its mandate, and consistently there's complaints that we have heard.
Even with the ordinary diseases that the NHIA takes care of it, I mean, it gets to a point where you are only giving paracetamol syrup. When you need antibiotics and some expensive drugs, you would have to get them on your own. And let's look at dialysis. Now, we are hearing that Kolebu is charging 765, even though the CEO came to say it's not approved. I mean, give or take, if that is how much is being charged, and this is on national health insurance. I mean,
that'll be a heavy burden. I get that.
I mean, we have to be real.
Except that what we do with our system is that if you want to find a way, government cannot have tax and import duties on the products that's supposed to also be on the National Health Insurance Scheme. It's almost like robbing Peter to pay Paul.
Yeah, it is.
So then, if you had reduced the taxes, if you actually removed the import duties, it would make sense to have a system where then when you put it on the NHIA, it will be at a reduced cost.
Yeah.
It will not be like the private person providing the resource. That is one part. And I'm saying people have said there are additional sources of funding that could easily be redirected to this.
Like the COVID
levy, for example. We are still paying. We've not been told when we are going to stop paying. So if we direct that alone and say we have selected some of these 2 or 3 of these disease conditions, specifically under NHI being taken care of, or set up an individual institution which will provide the support for it. It's easy to identify people with that, give them direct and targeted healthcare, which will then solve that problem.
Sure.
Of course, after dealing with all the prevention and the education and the other things that come in the value chain.
It's interesting, I mean, but the question also remains, how difficult is it for government to give waivers to some of these things that come in to treat patients with kidney diseases? If we can give waivers to like Boaks, some foreign companies, we give waivers
that even international bodies have complained
exactly.
about.
Why can't we give waivers to these?
We give it to hotels. We give it to, I mean, see, I've heard the Kolebu CEO say that there's something like that in place. They were just in a hurry. That's why in their most recent procurement, they didn't comply with that. I think what is required is we getting back to the system where everybody's guaranteed that because these are national emergency health issues, there's a reason why we believe in a health insurance system. The UK's NHS takes care of dialysis and kidney care. So if you are in the United Kingdom today, in fact, I recall in 2020 March, just before COVID became an issue, the conversation in that country was that, what do we do with the kidney condition of our people? Because Finland and Co are supplying the machines to people at home, and that it was backward for them to continue on that path.
I will come back.